Polycystic ovary syndrome, PCOS, is a common hormonal disorder that affects females with ovaries, typically during their reproductive years. It is characterized by a combination of symptoms related to hormonal imbalances and metabolism, which can impact menstrual cycles, fertility, appearance, and long. Core issue involving several key hormones. Androgens cause hirsutism, acne, and hair loss. Insulin increases androgen production. LH triggers excess androgen, disrupts ovulation. FSH, low levels prevent ovulation. Let's take a look at the 7 key characteristics of PCOS. Hyperandrogenism, elevated androgens. Women with PCOS typically have higher levels of androgens, male hormones, such as testosterone. This can lead to physical manifestations like hirsutism, excessive hair growth on the face, chest, back, and other areas, acne, severe persistent acne that may be resistant to treatment, and alopecia, thinning hair or male pattern baldness. Ovarian dysfunction, irregular menstrual cycles. The menstrual cycle can be irregular, infrequent, or prolonged, often characterized by infrequent periods or absence of periods. And ovulation. The ovaries may not regularly release eggs, leading to challenges with fertility and difficulty getting pregnant. Insulin resistance. Insulin resistance and hyperinsulinemia. Many women with PCOS have insulin resistance, which means the body cells do not respond effectively to insulin. This can lead to elevated insulin levels and an increased risk of developing type 2 diabetes. Weight gain. Insulin resistance is often associated with weight gain, particularly around the abdomen, contributing to obesity in some cases. Polycystic ovaries. Despite the name, not all individuals with PCOS have polycystic ovaries. However, in many cases, the ovaries may become enlarged and contain multiple small fluid sacs, follicles, that surround the eggs. These follicles are not harmful but can prevent chronic low-grade inflammation. Inflammatory markers. Women with PCOS may have slightly elevated levels of inflammatory markers in their blood, which are associated with the conditions cardiovascular and metabolic risks. Metabolic syndrome. Increased risk of metabolic syndrome. PCOS is associated with a higher risk of metabolic syndrome, which includes a combination of high blood pressure, high blood sugar, excess body fat around the waist, and abnormal cholesterol or triglyceride levels. This increases the risk of heart disease and type 2 diabetes. Mood disorders. Psychological impacts. Women with PCOS are more prone to anxiety, depression, and mood swings. These may be related to both hormonal imbalances and the stress of managing the physical symptoms of PCOS. Managing symptoms and reducing complications for PCOS. Healthy diet. Focus on whole grains and reduce sugar. Regular exercise. Improve insulin sensitivity. Weight management. Helps regulate menstrual cycles. Stress management. Balance hormones throughout relaxation. Regular checkups. Early management of symptoms. Adequate sleep supports hormonal balances. Additional aspects of PCOS. Diagnosis. PCOS is typically diagnosed based on a combination of clinical signs, symptoms, and diagnostic tests, including blood tests and ultrasounds. Treatment options. Management may include lifestyle changes, medications like birth control pills, metformin, or anti-androgens, and other therapies to address specific symptoms such as acne or infertility. Long-term risk. Women with PCOS have an increased risk of developing conditions like type 2 diabetes, cardiovascular disease, and endometrial cancer. Fertility treatments. For those struggling with infertility, treatments may include ovulation induction drugs, lifestyle changes, or assisted reproductive technologies like IVF. Personalized care. PCOS management often requires a personalized approach, as symptoms and responses to treatment can vary widely between individuals. Research and advances. Ongoing research continues to explore the causes, best management practices, and potential new treatments for PCOS. Lifestyle integration. Incorporating holistic approaches such as nutrition counseling, physical therapy, and alternative medicine can complement conventional treatments. PCOS is a challenge, but with the right support and management, you can turn it into a journey of self-discovery and empowerment.